Welcome to the Deep Dive Conversation.
Great to be here.
Today we are really getting into breast augmentation. We want to sort of pull back the curtain on what's involved, figure out who might be thinking about this, who's a good candidate.
And what to expect, really, every step of the way.
Exactly. Think of it like a roadmap. From that very first thought, maybe seeing something online, all the way through to the final results. We've gathered quite a bit to unpack here. We'll cover candidacy, the consultation, which sounds super important, getting ready for the surgery.
The procedure itself, of course. And then recovery, results, and definitely the safety side of things. Can't skip that.
Absolutely. Critical safety considerations.
Yes.
This is the kind of insight you really need if you're considering something so personal.
It really is.
And to help us navigate all this, we're drawing on insights that reflect deep experience, like that of Dr. Francis, a board-certified plastic surgeon right here in New York City. He's got over 35 years of experience.
Wow, that's significant experience. His practice really understands this procedure. The goal is just to give you clear, honest information so you feel, empowered in your own decision. Understanding the path ahead is just essential.
Okay, so let's really dig in. Starting right at the beginning, someone's thinking about this.
Yeah.
How do you even know if you're a good candidate? What does that actually mean?
Well, look, first and foremost, it absolutely has to be your decision for you.
Right.
This is such a personal thing, and honestly, the best outcomes, the highest satisfaction, that comes when you're doing it purely for yourself, not for anyone else, not because you feel pressured.
That makes total sense. It's
Yep.
about your own confidence, your own feeling. So, okay, beyond that motivation, what are the sort of health and physical checkboxes?
Yeah, looking at the criteria, a few things consistently pop up. You need to be physically healthy, generally speaking. Not pregnant or breastfeeding, obviously. Your breasts should be fully developed. And, this is a big one, you need to have realistic expectations.
Realistic expectations. That sounds like it goes beyond just hoping for a certain cup size, right? It's at the whole process. Like healing, maybe looking at photos beforehand.
Oh, absolutely. Realistic expectations mean doing your homework. Looking at representative before and after photos, yes. But crucially, understanding what recovery really involves. That upfront knowledge, it sets reasonable expectations and honestly makes the whole recovery feel smoother.
Makes sense.
Beyond that, common reasons people start looking into augmentation are, feeling genuinely bothered that their breasts are too small for their frame, or maybe they're unhappy with changes, loss of shape, loss of volume after pregnancy, or weight loss, or just aging.
So it's not always just about going bigger. It can be about restoring shape or balancing things out.
Precisely. Other things we hear are maybe the upper part of the breast seems kind of empty, or there's noticeable asymmetry. One breast is different from the other, or perhaps the breasts just didn't develop in a way that feels right to the person. Maybe they have an elongated shape. These are all valid personal reasons to seek out a consultation.
Okay, that clarifies the who quite a bit.
Yeah.
So once someone's been thinking seriously, maybe they see themselves in those descriptions. The next huge step is that consultation with a surgeon. What should you be ready for in that meeting? It sounds critical.
The consultation is, it might be the single most important part of the whole journey before any surgery happens. It's where you and the surgeon really talk things through.
Right.
As the patient, you need to be prepared to be really open about why you want this. What are your specific goals? What outcome are you hoping for? And you have to lay out your full medical history.
Everything.
Everything. Conditions, allergies, past treatments, surgeries, every single medication, vitamin, supplement you take. And you need to be honest about alcohol, tobacco, any recreational drug use, full transparency.
And for breast procedures specifically, family history of breast cancer, previous mammograms or biopsies, that's got to be discussed too, right?
Vital. Absolutely vital. That whole medical picture is foundational. Now, on the surgeon side, they're going to evaluate your overall health, identify any potential risks. They'll examine and measure your breast really carefully, look at size, shape, skin quality, nipple, and areola position, all of it.
And I assume they take photos for planning.
Yes, clinical photos are standard practice. Based on all that information, your goals, your history, the exam passion, the surgeon will then discuss your options. They'll recommend a treatment plan tailored just for you. And critically, they'll walk you through the likely outcomes, but also the potential risks and complications.
Wow, okay. That sounds like a ton of information to absorb. You probably need to go in armed with questions. What are the absolute must-asks for that consultation?
You absolutely should bring a list. It's so easy to forget things in the moment. Ask about their qualifications. Are they board certified by the American Board of Plastic Surgery? That's the key one.
Okay.
What was their specific plastic surgery training like? How much experience do they actually have performing breast augmentation? Do they have hospital privileges for this procedure? Is the surgical facility where they operate accredited? You need to confirm, are you a good candidate in their expert opinion? What do they expect from you to get the best result? And where exactly and how will the surgery be done?
And what about the implants themselves? Do you get into those details?
Okay, dive deep. Recommended implant details. Shape, size, surface texture, smooth or textured. Where will the incision be made? Where will the implant actually be placed under the muscle, over the muscle? Understand the recovery timeline, what support you'll need at home. Go over every single potential risk and complication they mention. Ask how they'd handle it if something did go wrong. Don't be afraid to ask about needing future surgeries down the line. How might this affect breastfeeding, if that's relevant for you? How might your breasts change long-term with aging, weight changes, future pregnancies? And a really important one, what would your breasts likely look like if years later you decided to have the implants removed without replacing them?
That is a comprehensive list.
And
It really underscores just how important it is to feel comfortable, to really trust the surgeon you choose.
it absolutely does. And look, it's completely normal to feel a mix of things. Excited, maybe a bit anxious.
Sure.
You should definitely share those feelings with your surgeon. Finding someone you genuinely trust is paramount. Someone with that extensive experience, perhaps like Dr. Francis in New York City, who's guided countless patients through this and understands all these nuances, that's key to feeling confident and truly informed.
Okay, so consultation done, decision made. You're moving forward. What does the prep phase look like? How do you actually get ready for surgery day?
Preparation is it's another critical step for safety and for a good outcome. There are several things you'll likely be asked to do.
Like what?
Often include some pre-op blood tests, maybe adjusting certain medications you normally take. And crucially, if you smoke, you absolutely have to stop well before the surgery date.
Right. Smoking affects healing.
Dramatically. You'll also need to stop taking aspirin, certain anti-inflammatory drugs, things that can increase bleeding risk, and stopping any recreational drugs is also a definite requirement.
Sounds like pretty standard pre-surgery stuff. Anything specific to breast augmentation prep?
Well, a really vital point that's always emphasized is where the surgery happens. For your safety, it needs to be in an accredited facility. That means an accredited outpatient or ambulatory surgical center or a hospital.
Not just anywhere.
Definitely not. And if it's outpatient, it's mandatory. You must arrange for someone reliable to drive you there, pick you up, and this is crucial, stay with you for at least that first night after surgery.
Got it. You need support.
You do. An experienced surgeon, someone like Dr. Francis with his 35 plus years, they deeply understand how vital these prep steps are. It's all about patient safety and setting the stage for the best possible outcome.
Safety first. Always. Okay, let's jump to the day itself. Can you sort of walk us through the basic steps of the actual breast augmentation procedure?
Sure. It generally follows a pretty set sequence. Step 1, anesthesia. Medications are given so you're comfortable and safe throughout the whole thing. Whether it's intravenous sedation or general anesthesia, your doctor will recommend the best option for you based on your health and the plan.
Okay, comfortable and safe. Then the surgeon actually starts.
That's step 2, the incision. The goal here is to place these incisions in spots where they'll be least noticeable later on. Minimize visible scarring.
Where do they usually go?
Common spots are along the edge of the areola, that darker skin around the nipple, or in the fold right underneath the breast, or sometimes up in the armpit. It's worth noting, approaches through the belly button. They tend to have higher complication rates, so they're much less common now.
Interesting.
The specific incision choice depends on, well, several things. The type of implant, the size you're going for, your own anatomy, and frankly, the surgeon's preference and experience with different techniques.
Right, so it's tailored. Okay, incision made. What's next?
Step 3, inserting and placing the implant. So, after the incision, the surgeon creates a pocket in the breast area.
A pocket.
Yeah, a space. And the implant is carefully inserted into this pocket. Now, there are 2 main options for where this pocket is made. It can be under the pectoral muscle.
Okay.
That's called submuscular placement. Or it can be placed directly behind the breast tissue, but on top of the muscle. That's submammary or subglandular placement.
Under or over the muscle. Got it. And how do they decide which one?
Again, it depends. Implant type, the size increase desired, your natural body type, And your surgeon's recommendation based on what they believe will give you the best, most natural-looking result.
Okay, makes sense. Implant is in place. How do they finish up?
Step 4 is closing the incisions. This isn't just sewing the skin. They close the tissue layers within the breast using sutures first. Then the skin incisions are closed, usually with more sutures, maybe skin adhesive or surgical tape.
And the scars.
Well, the incision lines themselves will fade over time, definitely. But how good the final scar looks? That can be influenced by your genetics, unfortunately. Also by nicotine use, another reason to quit smoking, and whether the incision heals perfectly without any infection.
Right, and then step 5, the big reveal.
Exactly, seeing the results. The change from the augmentation is visible immediately, right there after surgery. And this is important to manage expectations, the final settled look. That takes weeks to really emerge as all the swelling goes down.
Okay, so recovery starts the second the surgery ends. What does that look like? Right after, and then in the days, weeks following.
Immediately after, you'll wake up, your breasts will be covered in dressings, usually gauze, and you'll be snug in either an elastic bandage or a special surgical support bra.
To hold everything in place.
Exactly. It minimizes swelling and gives crucial support to the healing tissues. You'll hang out in a recovery area for a bit, being monitored. Usually, if everything's stable, you can go home after about an hour or so.
And you leave with homework, I bet. Instructions.
Oh, absolutely. Detailed post-op instructions, and you must follow them carefully. Things like wearing that support garment constantly, how to care for your incisions.
Meds too.
Typically, yes. Usually pain medication to manage discomfort, and often antibiotics just to prevent infection.
How long did that initial, real soreness last?
You definitely need to take it easy for the first few days. There's a small chance of minor bleeding into those implant pockets early on, so no heavy lifting. The really acute pain usually settles down within, say, 1 to 5 days. But you should expect some level of soreness and swelling for a few weeks. It takes time.
And getting back to normal life. Exercise.
Your surgeon will give you very specific directions on that. When you can gradually start resuming exercise, normal activities, you follow their timeline precisely.
Okay. And the final look.
Yeah?
When you really see it, without all the puffiness.
Well, you see the change right away, but the final aesthetic result, that takes weeks to really settle in as the swelling completely resolves and the tissues relax around the implant. Some patients might even need to wear a special band, like a bandeau strap across the top to help shape things nicely.
Oh, okay.
The incision lines, like we said, they fade over months, even years. The key to getting the best result and smoothest recovery: follow those post-op instructions to the letter and go to all your follow-up appointments. Super important.
This brings up something really important, thinking long-term. We kind of think of surgery as one and done, but are breast implants forever? Are they lifetime devices?
That is such a critical point, and something people might not fully grasp beforehand. Breast implants are not considered lifetime devices.
Really?
No. It's very possible they will need to be replaced at some point down the road, maybe due to wear and tear, rupture, or just because your body changes over time.
So you need checkups.
Definitely. Regular annual exams with a plastic surgeon are important, not just for general breast health screening, but specifically to check the implant integrity, make sure everything is sitting right. Ongoing care from someone experienced like Dr. Francis becomes part of your routine.
And our bodies change anyway, right? Implants or not.
Exactly. Aging, weight going up or down, hormonal shifts, gravity. It all affects how your breasts look over the years. If those changes become significant, sometimes procedures like a breast lift or swapping out the implants for a different size or style might be options later on to kind of refresh the look.
You mentioned critical safety things earlier. What are the big ones people need to know about for the long haul, like years after the surgery?
Yeah, beyond the immediate risks of any surgery, there are long-term things. For silicone implants, the FDA currently recommends screening.
Screening? For what?
For what they call silent rupture, where the implant might leak without you noticing. They recommend an MRI or an ultrasound starting about 5 to 6 years after the initial surgery, and then repeating that check every 2 to 3 years after that, even if you feel totally fine, no symptoms.
Wow, okay, that's a commitment. 5 to 6 years, then every 2 to 3.
It is, and it's also absolutely vital to talk with your surgeon about the known, though very rare, risks of certain cancers that can form in the scar tissue, the capsule, around the implant. Specifically, BIA-ALCL, that's breast implant-associated anaplastic large cell lymphoma, and also BIA-SCC, a type of squamous cell carcinoma.
Okay, those sound serious, even if rare.
They are, and you need to understand them. You should also discuss what's sometimes called breast implant illness, or BII. It's a collection of systemic symptoms some women report experiencing. Open discussion about all this is key.
That screening advice for silicone is really concrete. I imagine a lot of people might not know that.
Yeah.
Okay, let's quickly touch on the implants themselves. What are the main types you choose between?
Right. When you break it down, the main difference is what's inside. Saline or silicone.
Saline is salt water.
Yep, sterile salt water. If the outer shell were to leak or rupture, the implant deflates and your body just safely absorbs the saline. They tend to give a pretty uniform shape and feel, maybe a bit firmer. Saline is FDA approved for augmentation for women 18 and older. There are also some variations like structured saline, which have an internal structure trying to mimic a more natural feel.
Okay. And silicone?
Silicone implants are filled with a silicone gel. It's more cohesive, meaning it sticks together. It's generally thought to feel a bit more like natural breast tissue.
And if they leak?
If a silicone implant leaks, the gel usually stays inside the shell or maybe just in the immediate scar tissue around it. The implant doesn't typically collapse like saline does, but because a rupture might not be obvious, that silent rupture we talked about, that's why they need those regular checks, the ultrasound or MRI, to monitor them. Silicone implants are FDA approved for augmentation in women 22 and older.
I've heard people talk about gummy bear implants. What are those?
Gummy bear, yeah, that's the nickname for form-stable implants. They use a thicker, highly cohesive silicone gel. It's designed to hold its specific shape, even if the shell were somehow compromised.
So they're firmer.
Generally, yes, firmer. And if they are anatomically shaped, teardrop-shaped, they often give more projection at the bottom. The catch with shaped implants is, if one happens to rotate in the pocket, it can look unnatural and might need surgical correction. They also usually need a slightly longer incision to insert them.
Okay. And besides what's inside, are there different shapes or textures on the outside?
Yes. Implants can be. Round often gives a fuller look, especially up top, and rotation isn't really an issue visually. Or they can be shaped, like those form-stable ones, designed to mimic a more natural slope than the surface texture. Smooth implants are the softest, move most naturally. Downside, maybe more visible rippling, especially if you have thin tissue.
And textured.
Textured implants have a slightly rougher surface. The idea is that the scar tissue kind of grips onto it, making it less likely to move around. It might also slightly reduce the risk of getting a tight scar capsule called capsular contracture.
That texture connects back to the safety point you made earlier, right?
Yeah.
About BIA-ALCL.
It does. And this is an absolute critical discussion to have. Current understanding is that BIA-ALCL occurs most often in patients who have or have had textured implants compared to smooth ones.
This is a major consideration.
Huge. It's why that detailed conversation about the pros, cons, risks of every single option, fill, shape, texture with a board-certified plastic surgeon is just non-negotiable. And, technology changes. New implants might come out. So staying informed through regular follow-ups is key, no matter what type you initially choose.
It really does all seem to circle back to that fundamental choice.
Mm.
Picking your surgeon. It feels absolutely paramount, given everything we've talked about, the medical side, the artistry, the long-term commitment.
It truly is. Probably the single most important decision you make in this whole process. Finding a qualified, board-certified plastic surgeon is non-negotiable. We mentioned questions before, but it's worth hitting again. Are they certified by the American Board of Plastic Surgery? Do they have specific, expensive training in plastic surgery? Crucially, experience performing this procedure. Do they have privileges at an accredited hospital? Is their surgical center accredited?
Asking those tough questions up front gives you confidence, right? That they meet the highest standards.
Exactly. When you work with a board-certified plastic surgeon who has significant experience, like Dr. Francis here in New York City, you're putting your trust in someone who adheres to rigorous standards for safety and skill. They can offer that personalized guidance and care that is just so essential for this whole journey.
We have covered so much ground in this deep dive. We've gone from thinking about candidacy, through that vital consultation, preparing for surgery, understanding the procedure steps, navigating recovery, seeing results, looking at implant types, and those really critical long-term safety points. It seems abundantly clear this isn't a decision to take lightly. It's significant, potentially life-altering, and needs careful thought, real research, and understanding the whole picture, not just surgery day.
That's it, exactly. Understanding the entire path of the prep, the surgery, the recovery, and especially that long-term follow-up and care that makes all the difference.
So if you were considering breast augmentation, maybe mull this over. Thinking about the fact that implants probably aren't lifetime devices, that they require ongoing monitoring, doesn't that fundamentally shift how you approach finding the right surgeon? and committing to those future checkups. It really turns it from a one-off event into more of a long-term relationship with your health and your chosen doctor, doesn't it? Definitely something to think about as you consider this journey.
It certainly is food for thought, a very important perspective.
If you are ready to explore this more, maybe take that next step on your personal journey. Get professional guidance. We really encourage you to book a free consultation. You can do that by calling 212-226-0677. Or you can visit online at www.francisnyplasticsurgery.com.